Hello, this is Dr. Toshia Palmer, School Social Worker with the Student Support Centers of San Juan Unified School District. Today, I'll be providing you with a brief professional development tool on fostering self-care for teachers. Fostering self-care for teachers. The purpose of this presentation is to help teachers gain a general understanding of self-care and how self-care has an impact on reducing secondary traumatic stress, such as vicarious trauma, compassion fatigue, and burnout. By the end of this presentation, teachers will be able to identify the following: the facts about self-care, why self-care is important, how to recognize signs of secondary traumatic stress and/or compassion fatigue, self-care strategies, and how to incorporate those self-care strategies at home, within your classroom, and within your work environment. The facts about self-care. What self-care is not. Self-care is not a selfish act. It's rather about knowing what we need to do in order to take care of ourselves so that we are well able to take care of others. Self-care is any activity that we do deliberately in order to take care of our mental, emotional, spiritual, and physical well-being. Self-care is also the key to improved mood, reduced anxiety. It is also the key to building and maintaining good relationships with yourself and with others. When discussing the importance of self-care for teachers, it's important to consider the demographics of our student population. Let's take a look at our student demographics within the context of child maltreatment, youth alcohol and substance use, child and adolescent mental health, victims of harassment and bullying, and new students and families who are transitioning from other countries into the U.S. According to Child Trends, as of 2016, the rate of substantiated child maltreatment in regards to physical, sexual, psychological, and emotional abuse has shown little change over the past several years. The significance of this data reveals that teachers are challenged with the task of providing an inclusive and democratic educational learning environment to students who have experienced complex trauma and adverse childhood experiences. According to the California Healthy Kids Survey on alcohol and other drugs, current use of any alcohol or drug use was reported by 7% of 7th graders, 20% of 9th graders, and about 30% of 11th graders. In addition to providing academic instruction to students who are victims of child maltreatment, teachers are also challenged with the task of serving students with alcohol and substance abuse issues. Furthermore, as we can see, there are symptoms of depression and suicide with regards to chronic sadness and hopelessness that are fairly high among all grade levels, granted that there has been some decline in the data since 2015. The California Healthy Kids Survey also reveals that harassment and bullying continues to be a systemic issue. Although with some decline in the data compared to 2015, there is still a fair amount of students who report being harassed or bullied. In addition to the data presented on child maltreatment, alcohol and substance use, harassment and bullying, it's important to pay attention to the demographic data on children and adolescents' mental health conditions as well. As you can see, approximately 1 in 5 youth aged 13 through 18 experiences a severe mental disorder at some point during their life. And for children aged 8 through 15, the estimate is about 13%. Looking down below, over 1/3 of students with a mental health condition aged 14 through 21 and older are currently served by the special education. They tend to drop out, and this is the highest dropout rate of any disability group. It's also important to remember that new students and families who are transitioning from other countries into the U.S. also experience trauma, as they may have challenges as they try to adapt to the change of culture, language, and a new living environment. In order to help aid teachers' efforts in fostering self-care, teachers may want to consider utilizing a universal screener in order to identify students that they have observed to be at risk or could benefit from additional student support services. This screener is known as SABERS. SABERS stands for Social, Academic, Emotional, Behavior Risk Screener. It's a brief and efficient evidence-based tool that's used for universal screening of K through 12 students who are at risk of social, emotional, and behavior problems. In order to help support your efforts of self-care as you strive towards cultivating a strong and healthy classroom environment, please feel free to reach out to San Juan Unified School District Multi-Tiered Systems of Support Centers. So why is self-care important? Well, working with children and adolescents who are victims of child maltreatment, who use alcohol and other drugs, who have either been harassed or bullied, who have severe mental health conditions, or who have transitioned from other countries into the United States, this warrants the need to foster a culture of community and support for teachers who are working in trauma-adjacent environments. Therefore, it's important to help retain our teachers by providing them with the tools that they need in order to foster self-care. This can translate into increased effectiveness in their role in the classroom. And we also want to help support teachers and their ability to cope with the demands of the classroom and the demographics of our student population. Self-care is also important because it has an impact on our relationships and how we connect with others, including our students. With regards to social connectedness, youth who have healthy relationships with significant others, such as teachers, in addition to family and the community, have the following positive trajectory of life outcomes. They tend to deter from deviant behaviors that are precursors to incarceration, and they also tend to have better outcomes with mental health and behavioral health treatment. Therefore, as professional educators, it's necessary to examine ourselves and identify where we are on the continuum on the zone of involvement when working with students. But we can only do that if we're taking care of ourselves. When we're not taking care of ourselves, we can either find ourselves to be disengaged or overly involved, whereas where we need to be is right in the middle, maintaining a healthy balance with regards to making sure that we are in the helping and teaching relationship on the continuum. How to recognize signs of secondary traumatic stress and/or compassion fatigue. In a school organization, leaders and peers should look for collective symptoms such as chronic absenteeism, struggles among teachers' teams, and also aggressive staff behaviors. Symptoms can also include colleagues who are feeling overwhelmed or who are unable to finish their work. As you can see the signs of secondary traumatic stress and/or compassion fatigue, there's also symptoms that are located within the physical domain, behavioral domain, and the emotional and psychological domains. Within the physical domain, you tend to see symptoms that consist of exhaustion, insomnia, and headaches. With regards to the behavioral domain, symptoms may include increased use of alcohol and drugs, anger and irritability at home and/or at work, avoidance of clients, patients, and students. And within the emotional and psychological domain, individuals may exhibit symptoms of emotional exhaustion, negative self-images, depression, all the way down to suicidal thoughts. If you are exhibiting any signs of suicidal ideation, or if you know anyone who is exhibiting any signs of suicidal ideation, please contact 911 immediately to report your emergency, or go to the nearest emergency room and obtain a psychological evaluation. And especially if you're having thoughts of suicide, please do that in order to take care of yourself. You can also contact your primary care physician to report any challenging physical symptoms and obtain a physical evaluation. Or if you're a San Juan Unified School District employee, you can utilize the following health and wellness resources through San Juan Unified School District, such as the Employee Assistance Program and the following resource link below. Again, if you or you know anyone who is exhibiting any type of symptoms of suicidal ideation, there is a number that you can call. It's the National Suicide Prevention Hotline, which is 1-800-873-8255. Let's move into some self-care strategies.
So I said it was simple, but how do we even begin to take care of ourselves? Grab a notebook, start a journal. Tell yourself that you are enough, and do that every single day. Drink enough water, exercise. Practice mindfulness, which is just meditation, which is just sitting still, quietly, for a few minutes. Try yoga. Get curious about your relationship with your phone and social media. Practice random acts of kindness. Ask for support and begin to connect with who you truly are. Why? Why bother? Why bother doing all these things? Because you are exquisite.
Yes, teachers, you are very exquisite, and we need you. We need you to take care of yourselves so that you can take care of our future. In addition to self-care strategies, it's very, very important to support yourself first in order for you to be able to support those who are around you, such as your students. So take time to nourish yourself, get plenty of sleep, exercise, maintain a healthy diet. You can even practice skills such as prayer or mindfulness strategies. Do things that you enjoy. And remember that you are worthy of being created also. Other self-care strategies consist of implementing in-school support. You can advocate for professional development, courses around self-care or mindfulness. You can even bring in a meditation or a yoga teacher to facilitate healthy exercise. Or you can lead the staff in some restorative practices such as restorative circles. You can also give your staff an outlet and a safe space to talk about the traumas that they've taken on, and then provide training on healthy coping skills. Also, in regards to self-care strategies, you can develop and maintain a self-preservation mindset. One way to build some healthy emotional boundaries is to identify what you wish you could do versus what you can actually do. You cannot eradicate or prevent all suffering for your students, but you can show up each day, support your students, advocate for them, and love them. Self-care strategies also consist of building a strong peer network and identifying an accountability partner. Take a walk with a colleague during your prep. Begin meetings with some deep breathing exercises, and take time to compliment the efforts of others. Positivity is contagious, and peer support makes a strong foundation for your hard work. You can't pour from an empty cup, so take care of yourself first. Thank you for taking the time to listen and review this brief professional development tool on fostering self-care for teachers. Once again, this is Dr. Toshia Palmer, school social worker with the Student Support Centers of San Juan Unified School District. Thank you so much and have a great day.